you doing? My name is Mariza, and I will be doing the motor exam on you today. How you doing?
Good.
Okay. Letty, can you tell me where you are?
Clearwater, Florida.
Can you tell me what time it is?
10 o'clock.
Good. And I would also like you to count forward by 7, so start with 7.
Okay, 7, 14, 21, 28.
Good. Now I will be inspecting your skin and make sure that there are no rashes or lesions, and I don't see anything. I will check for skin texture, and your skin is soft and moist. I will also check for skin turgor. We'll go like this, and I don't see any tinting. Check your legs as well. And I will check for skin temperature. Your skin is warm to touch. Now I will inspect your hair. You look like you got a full head of hair, no loss, and your hair is thick and equally distributed. Now I will check your nails. Your nails look nice and clean, and we will palpate for capillary refill, less than 3 seconds. On the toes, less than 3 seconds. I'm also gonna have you do your index fingers like this, and there is no clubbing present. Good. And next I will palpate your head and tell me if you feel any tenderness or any soreness anywhere.
No.
Nope. Okay. Now I will check your lymph nodes, and we will start with the occipital, post-auricle, pre-auricle, tonsillar, submandibular, submental, the posterior cervical chain, and the anterior cervical chain. And we'll do the other side, posterior and anterior cervical chain. And we'll check the supraclavicular. Everything is good. Now I will check the temporomandibular joint, TMJ. Open and close your mouth for me. Okay, good. And clench your teeth. We'll check for the masseter. I'm looking at the facial symmetry, and the face is symmetrical. Now I will be grabbing a cotton ball, and I'm going to put it on your face, and you will close your eyes and tell me where you feel it. Okay, so it'll feel like this, and close your eyes, and just tell me when you feel it.
Left cheek. Right cheek.
Good. Now I will have you smile, frown, purse your lips like you're whistling, puff out your cheeks like this. Good. Raise your eyebrows and close your eyes tight, and I will open them. Okay, good. That is good. And now I will have you push my hand towards that side. Good. And then the other side. Shrug your shoulders. Put them down. And now against resistance. Good. Perfect. And now we will check the eyes. And I'm looking at the eyes. I'm inspecting the eyes, and I don't see any redness. The conjunctiva is clear. The sclera is white. There are no skin tags or lesions around the eyes. You feel the periorbital area. There is no swelling. You feel soreness?
No.
No. Good. Okay, now I will we will do a few eye tests. So I will grab this card, and what I'm going to have you do is hold it at reading level, and you're going to cover one eye and read the lowest line for me. So cover one eye, doesn't matter which one first.
Okay.
And what is the lowest line you can read?
The bottom one.
Okay, read it for me.
428 739.
Check. Okay, good. So your vision is 20 out of 20 for that eye, and I'm going to have you do the same thing for the other eye.
Okay. 428 739.
Okay, let me see. Yep, perfect. Your vision is 20 out of 20 for that too. Now, what we're going to do is check in your peripheral vision. So what I'll need you to do is cover one eye.
Okay.
And then I'm going to cover the same side eye. And you will just, I will move my fingers, and you will just tell me when you first see my fingers.
Okay.
Okay?
Now. 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 Now.
Okay, good. Now we will cover the other eye, and we're going to be doing the same thing. Tell me when you start seeing my fingers.
Now.
the next thing we'll do is I'm going to grab my pen light and I will just be shining it at the bridge of your nose. You don't have to do anything. Okay, good. And the pupils respond. And actually, I will keep this. We will do the cover and uncover test. So what I'll need you to do is cover your eye again. And I'm going to just place this, just focus on the object.
Okay.
Now move your hand, I'm sorry. Okay, good. And the pupils respond. And now we will do the same thing with the other eye. So focus and remove your hand. Good, and the pupils respond. Okay. And next thing we'll do is the 6 movements. So all you're gonna have to do is just follow the pen light with your eyes, not your head.
Okay.
Okay, good. And then follow the pen light with your eyes again. Good, there is no lid lag noticed. And then now I'm just going to check for reflex. I'm going to close your eye first. And the pupil responds. And then we're going to check for consensual. And the pupil responds. Then we're going to do the same thing with the other eye. And consensual. And then I'm going to need you to focus on an object far away. And the pupils dilate, and then focus with the one close, and the pupils constrict. Perfect. Now I will be moving on to the ear. I will inspect your ears. I do not see any skin tags or any lesions around the ears. I will palpate the ears. And I don't feel any masses or anything, so that's good. We will be performing 3 hearing tests. One will be, you will close one ear and I will whisper on the other ear. And you will tell me what I whispered, and we'll repeat the same thing with the other ear. So cover one ear, doesn't matter which one. Okay.
7, 8, 9.
Good, now cover the other ear.
9, 10, 11.
Perfect. Now, we will do the Weber test, so I will activate the tuning fork. I will put it at the base of your head, and you will tell me how you feel the vibration. Do you feel the same on both ears?
Equal.
Equal? Perfect. And now we will do the Riney test. So I will activate the tuning fork. I will put it behind your ear at the mastoid bone. You will tell me when you stop feeling it. When you stop feeling it, I will put it at the front, and then you will tell me when you stop feeling it then. Okay?
Stop feeling it.
Okay.
Stop feeling it.
Good. So that's good. That's what we're looking for. So when we put it in the front, you hear it twice as longer than the mastoid bone. Now I'm going to do the same thing for the other ear. Tell me when you stop feeling it.
Stop feeling it.
Okay.
Stop feeling it.
Good. Perfect. Now the next thing we will do is I will inspect the nose. The nose is equal to the face. I will palpate it. There are no ridges. Now I will have you lift your head up so I can look. And the turbinates are the same color as the surrounding tissues. And the nasal mucosa seems moist. Okay, let me check the other side. Same thing, turbinates are the same color and the mucosa is moist. Now I'm going to inspect the lips, and I don't see any lesions around the lips, and I will have you open your mouth and put the sticker tongue out. Going to look around, the teeth look intact. I don't see any lesions, and the tonsils are pink. The buccal mucosa is moist. Now, I am going to have you stick your tongue out. I'm just going to check the sides of the tongue for lesions, and I don't see any lesions. And one more thing. Stick your tongue out and say ah. The uvula rises, and that's what we're looking for. And then stick your tongue out and then move it side to side. Perfect. Now I will inspect the neck. I don't see any distension or any vein distension. I will palpate the neck. I don't feel any masses. Good. The trachea is midline. There's no tracheal tug. And then now we will check for the thyroid. And what I'm going to do is I will have you take a sip of water. Don't swallow it. I'm going to have you tilt your head on one side, and I will check one side, and then you can. I'll tell you when to swallow, and we'll do the same thing with the other side. So take a sip. And tilt your head this way. We'll push the trachea that way. Swallow. Good. I'll take one more sip. And tilt your head to the side. And swallow. Perfect. Okay. Next thing we will do is I will have you take off your shirt so we can inspect the posterior thorax first, and then we will move on to the interior thorax.
Okay.
Perfect. So first I will inspect the thorax, and I don't see, at first the skin, I don't see any rashes or anything like that. There's easy breathing, there is no retraction. The AP diameter is less than the lateral diameter. And then next thing I'll do is I will palpate. Tell me if you feel any soreness or tenderness.
No. No.
Okay, good. And then next thing I will do is tactile per minute. So all I need you to do is say 99.
99. 99.
And again.
99.
Good. Vibration feels the same on both sides. I'm gonna need you to take a deep breath for me and let it out. And there is expansion. See? Perfect. Next thing I will be percussing. So. And on the sides. Good. Next thing I will be auscultating your lungs. Take a deep breath. Good. The lung sounds clear and the rhythm is regular. And I will be checking for costovertebral angle tenderness. So tell me if you feel pain. You'll feel the thud, but that's okay. But if you feel pain. Do you feel pain?
No.
And do you feel pain?
No.
Okay, so that's good. That's what we're looking for. That means that the kidneys are not inflamed. Now I will be doing the same thing on the front. We will inspect the interior thorax, and I don't see any retraction. There's easy breathing, and the AP diameter is less than the lateral diameter. So next thing I will do is palpate the chest. Tell me if you feel any soreness or tenderness.
No.
Okay, good. And now I will be auscultating. Good. The lungs are clear. The respiratory rate is 14 breaths per minute. And if the lung sounds were abnormal, I would be doing a bronchophony, egophony, or whispered pectorility. but the lung sounds sound clear in all lobes. Next thing I will do, I will have you lay down and I will put a pillow behind your head. So we'll put your head over here. Now I will be inspecting the precordium, make sure that there are no heaves or thrills or pulsations, and I don't see anything. I will palpate. We'll palpate the apical pulse, and it's right there. It's irregular. Okay, good. The 5 areas we will be assessing is the aortic, which is in the second intercostal space, right sternal border. The pulmonic, which is in the second intercostal space, left sternal border. The tricuspid, which is in the second pulmonic, which is in the third intercostal space, left sternal border. The tricuspid, which is in the fourth intercostal space, left sternal border, and the mitral, which is in the fifth intercostal space, midclavicular. What we'll be assessing is for the heart sounds, the S1 and S2. S1 is the closing of the mitral and tricuspid valve, and the S2 is the closing of the aortic and pulmonic valve. The systolic murmur is heard after S1, and the diastolic murmur is heard after S2. And if there were any abnormal heart sounds, I would be having the patient sit up or move to the left side so that we can get the thorax closer to hear the heartbeat. Now I will start by, so I inspected, I palpated, and I will auscultate the heart. Good, and then now I will auscultate with the bell. And heart sounds are normal. Next thing I will do is I will auscultate the temporal arteries. I will palpate them first, and then I will auscultate them. They sound normal, and then I will do the same thing with the carotid, one at a time. Palpate, and then the next side, and I will auscultate. They sound normal. I do not feel any bruise. Next thing I will do is I will palpate the radial pulses. And it is good, 2+, and then the brachial. It's good, 2+, and then the popliteal. Good, +2, and the other side. +2, and the posttibial. The dorsal, and they are good, +2. Perfect. Now I will have you put your shirt back on. Oh, you know what? I'm so sorry. I'm going to have you lay down one more time. We're going to do the abdomen. At first I will inspect. I don't see any protrusions, hernias, and then next thing and then it's symmetrical, and the next thing I will do is auscultate the abdomen for vowel sounds. Good. I will palpate lightly. feel for the aortic pulse. It's right there. And I will palpate deeply. Do you feel any pain or tenderness?
No.
Okay, good. And then next thing I will do is palpate for the liver. So I will put my hands right about here. Take a deep breath. Let it out. Okay, so one more time. Take a deep breath. And let it out. Good. And I don't feel liver. Next thing I will do is palpate for the kidneys. We'll place my hands like this and then take a deep breath. And let it out. Do the same. Deep breath. And let it out. Good. And I don't feel the kidneys either. So they are not enlarged. The next thing we'll do now, I will actually have you put your shirt on and then we will move on with the musculoskeletal system and the neurologic system.
Okay.
Okay, perfect. And lay down one more time. So I'm gonna have you raise your leg and move it to that side and bring it up, yeah, and bring it inside and put it down. Good, and then do the same thing with the other leg. From that side, out, and then down. Perfect. Now let's bring your knee to your chest. Okay, put it down, and then let's do the same thing with the other leg. Put it down, perfect. And then let's bring the leg up with the ankle over the knee. So it will be like this, extension. Okay, good. And then bring your leg out and the heel over there, and bring your knee inside. Good. And then let's do the same thing with the other leg. So bring it out like that. Okay, good. And then bring the heel over here. Bring the knee in. Okay, good. Put your leg down. And then move your legs against perfect. And the strength is good. And now I will have you sit up and we will continue with the head. Okay. So I will have you put your head down. And then put your head up like this. And then move your head on the side and on the other side and rotate. Okay, good. Now push your head against my hand and do the same thing again against my hand. Perfect. Now we will move on to the shoulders. I will have you raise your arms up and then down. Okay, good. Now put your arms behind your back and behind your head. Good. And now leave your arms out straight. Now we'll push against resistance and good. Strength is good. The next thing we'll do is the elbow. So you'll have your arms straight and then bring them up like this. Bring them up. Good. And put your arms out like this and flip them on the other side. Perfect. And then put your arms out like this again. Going to pull and push. Perfect. Strength is good. Now we'll do the wrist. So go like this and then like this. Perfect. So put your, there you go. And then we'll push and we'll pull. Good. And then flex your fingers. Good. Now squeeze my hands. Good. Strength is good. We will do the knee. So lift your leg up just by sitting, just like this. Yeah, perfect. And then put it down. And we'll do the same thing with the other leg and put it down. Okay. And I will check the strength. Push against my hands. Perfect. Now, point your toes towards the floor and up and bring your heels together. Good. Now we'll check the strength. And that is good. The next thing we will do is focus on neurological. So we will do a few tests. At first we will do sensation. So what I'll do is I will grab a cotton ball and it'll feel like this, just like we did with your face, except for this time we will do it on your arms or your legs. And when I touch you, tell me if you feel it, yes or no. So close your eyes.
Feel on my left, my right, my leg, my left leg.
Perfect. The next thing we will do is I will grab the tuning fork and I will put it on your joints, or you will tell me where you feel it. If you feel it on your joints, the vibration.
My hand.
Feel it?
My right hand.
Good. And we'll do a few on the toes.
I feel it. Feel it.
And then we will do discrimination, which I will put an object in your hand, and you'll close your hand. You'll have your eyes closed when I put the object, and you'll tell me if you know what it is.
Okay.
Okay, so close your eyes. Okay, close your hand. What is it?
It's a key.
Okay, perfect. We'll do the other hand. What is it?
It's a cord.
Perfect. And then another thing I will do is I will draw a number on your hand, and you will tell me what it is with your eyes closed.
3.
Perfect. On the other hand, with your eyes closed.
7.
Good. And then the next thing we will do is I will you will have to tell me, we'll do joint position. So we will move your finger up, down, or neutral, and you will tell me what movement I'm doing with your eyes closed, okay?
Up. Down. Up. Down.
And we'll do a few with your feet.
Down. Up.
Good. And then the next thing we will do is coordination. So with your eyes closed, you will touch your nose with both hands, and then you will do it fast and repeat for a few times. So
Okay.
close your eyes, touch your nose with the other hand, and back and forth faster. Perfect. You can open your eyes. The next thing you will do is touch your nose and then touch my finger. So touch your nose with your finger, touch my finger, touch your nose, touch my finger. Okay, good. Perfect. And then let's do it with the other hand. Good. And then the next thing we'll do is I'm going to have you flap your hands like this on your thighs. Perfect. That's good. The next thing is we will do the deep tendon reflexes. So at first we will, so I will put your hand like this. And I'm going to be, so I will hit that and your arm should extend. Okay, good. So the reflex is present. And then we will do so we did the bicep, and then we will do actually, we do it on this side. So, we have to do it on both sides. So let me just finish this, I suppose. Now we'll do the tricep. Okay, good. Now we'll do the brachioradial. Good. The hand flexes, and we will do the same with the other arm. Good. We will do the tricep. Okay. And the brachioradialis. Perfect. Now we will do the patellar reflex. Right underneath the patella. Okay, we see a little flexion there, and then we will do the Achilles. Good, and then the Babinski. So we'll go underneath here, and the toes flex, and we will do the same thing on the other side. Okay, and the Achilles, and the Babinski will go on the lateral, and the toes flex. Perfect. And now I will check for balance. So do a sternal notch. So there is balance. Now I'll have you stand up. Close your eyes. Good. And balance there. And then the next thing we'll do, I will have you touch your toes. You don't have to actually touch your toes, just bend over. Perfect. And then go like this. And then come up, do it on one side, and then on the other side, and rotate your hip. Perfect. Now I will need you to walk normal a few steps. Good. And then come back tandem, and what we'll do is do heel to toe. So walk heel to toe like this. Perfect. And now I will have you walk on your heels. Good. And now back on your toes. Perfect. Now I will have you take a seat. I'm going to look at my notes one last time, make sure that I covered everything, and then we should be done shortly.